what is driving the shortening of lives in this country essentially are disparities in income and disparities in education.
We face a real danger in this country. It's what I call the danger of creating a wasted generation. Our teens and young adults are increasingly unable to find work.
In California, between 45% and half of all the jobs in the state of California are what we call middle skill jobs. They don't require a BA, but they do require some level of post-secondary education and training.
What does the workforce look like that will actually bring to life this 21st century healthcare delivery system that invests in prevention and heads off chronic disease long before it gets into the emergency room or the ICU? The brain trust for developing that workforce is represented in this room. So you're here in part because we want to learn how to better optimize pathways from high school to college to health careers. But if you took the word health out of that, you would still be working on improving the health of people in California and elsewhere around the country.
In California, the health sector is one of I think two growing sectors in our economy, and it offers tremendous growth opportunity for students, but it's also really important to the success of our economy and our health organizations.
By 2025, California will be 1 million college degrees short of meeting workforce projections. Only 2/3 of Latinos and fewer African American children will graduate with their class. The percentage of admits to the university have gone down for African Americans and Latinos, even while their average test scores and their average GPAs have gone up. We have a crisis in making higher education available to these students.
We have a lot of work to do to make sure that all students have the opportunity to engage in really high quality healthcare career education. Healthcare offers one of the best ladders to getting into the middle class of any industry. You don't need a doctorate or a BA to get into the healthcare industry. If we can get them certificates, get them employed, they're going to be earning a job that's going to put them on the ladder to the middle class. We have to increase career counseling dramatically and provide more opportunities for work-based learning. And I think some of the solutions to this include expanding career academies that are focused on healthcare. Again, there's lots of evidence that's going to increase the graduation rate if we do that. And offer the early college high school model as well, where students who are really doing well can graduate and earn at least some college credits, and if they're doing very well, even an associate's degree.
If they could develop at a regional level a highly skilled workforce and the skills that multiple manufacturers need, then you give the workers in that region or community the ability to move around with multiple employers and then pick up more work.
In Switzerland, they have what they call the dual apprenticeship system. Those students leave school for an average of 3 days a week, go out and work at a business or a company. It's really an incredible form of education.
And so we're now actually beginning to see that not only does career-focused, appropriate strategies engage. I want to stay in school, I'm excited to come to school, I'm really into it. It actually moves the needle on core academics that had nothing to do with the career focus as a core, right? Because they want to be there and they see the relevance for why math, science, technology, literacy are all important to their lives.
If we have industry partnerships around the state that are really developing actual career pathways, which is what we want to do, and we have industry coming to the table with practitioners from the education community and from workforce development, mapping out career pathways and really identifying ways for workers to move up into good jobs. Regional alliances are made up of the workforce investment boards and community college campuses, education providers in K-12, adult education providers, and also champions in industry that are working in each of these industry partnerships to help people move along a career pathway.
All of our juniors and seniors to have a paid internship. It matters when a young person goes into the workplace, sees it, feels it, and is paid for their work. We talk about this being an economic imperative. It is a social justice issue.
Hospitals and other healthcare organizations already recognize the need to offer their employees opportunities to continue their education and move up the ladder. this is really a fantastic opportunity to help young people of color and low-income students move up in the world. And I think healthcare is probably the leading industry that could really seize on this as a solution.